Gentlemen, I'm going to start with a hard truth. Every single day, I see men walk into my clinic with problems that could have been prevented. Erectile dysfunction that's become permanent. Painful curvature that makes intimacy impossible. Infections that require surgery. And in the most heartbreaking cases, cancer. And the sad part? Most of these men could have avoided all of it if they had followed a few simple habits. I'm Dr. Amelia Hayes, a board-certified urologist. I've spent over 2 decades helping men protect and restore their sexual health, and today I'm giving you 5 essential care tips that every man needs to hear. These tips will help you prevent sexually transmitted infections, penile cancer, erectile dysfunction, and Peyronie's disease. They will improve your performance, your confidence, and your longevity in the bedroom. And if you stay with me until the end, I'll share a bonus tip, one that most men have never heard of, yet it could save you from years of frustration, pain, or embarrassment. Before we jump in, make sure to subscribe and tap the notification bell so you won't miss helpful senior health tips like this. And if this topic speaks to you, type 1 in the comments. If not, type 0. I'd love to know. So let's not waste time. Here's tip number 1. Keep your penis active. Your penis is not just there for appearance. It's a living organ made up of spongy tissue, blood vessels, and nerves. And like every other part of your body, it needs regular use to stay healthy. Think of it like your muscles. Stop using your legs for months, and they'll weaken. Stop stimulating your brain, and your memory fades. And yes, the same applies to your penis. Every time you get an erection, oxygen-rich blood fills the erectile tissue. This oxygen keeps the tissue elastic, responsive, and healthy. When that doesn't happen often enough, the tissue can stiffen, literally. The elasticity fades, scar tissue may form, and the result is weaker, less reliable erections. Now, if you have a regular sexual partner or you masturbate, you're probably fine in this area. But I treat many men, widowers, those with health issues, or simply men with low libido, who go weeks or months without any erections. And for them, I often recommend tools like a vacuum erection device. This is not about pleasure alone. It's a medical way to stimulate blood flow. I've also had patients work with a pelvic floor physiotherapist. These specialists use targeted exercises and sometimes mild electrical stimulation to encourage healthy erectile function. The bottom line, if you don't use it, you really might lose it. Keeping your penis active isn't just a saying, it's biology. Tip 2, maintain excellent hygiene. Now this might sound obvious, but you'd be surprised how many men neglect it. And I'm not just talking about smelling fresh. This is about disease prevention. Let's take a sobering example. Brazil has one of the highest rates of penile cancer in the world, and one of the biggest risk factors, poor genital hygiene. Why? Because bacteria, sweat, and dead skin cells can accumulate, especially under the foreskin for uncircumcised men. This buildup, called smegma, can irritate the skin and create an environment for infection. Chronic inflammation over years can increase cancer risk. So here's the gold standard. Wash daily with a neutral or glycerin-based soap. Rinse thoroughly to remove any residue. Dry the area completely. Moisture can encourage fungal growth. And after sex, wash again. That last point is critical. The vaginal pH is different from penile pH. If you leave those fluids mixed, it can throw off your natural balance and cause irritation or infection. It takes less than 2 minutes, but it can save you from a lifetime of problems. What tip 3? Avoid sex with a partial erection. Here's something most men never think about, but I wish they did. If your penis is only semi-erect, partially flaccid and partially hard, it's in a vulnerable state. During penetration, the tissues inside can bend, stretch, or even tear microscopically. These micro-traumas may seem harmless in the moment, but over time, they can lead to nodules, small, hard lumps in the erectile tissue. And once those nodules form, they can cause the penis to curve when erect, a condition known as Peyronie's disease. Peyronie's isn't just cosmetic. It can cause painful erections, make penetration difficult, and in severe cases, make sex impossible. I've treated men who ignored this warning, and years later, they were facing surgery to correct severe curvature. It's a simple fix. Wait until you're fully erect before penetration. Your future self will thank you. Tip 4. Limit excessive pornography use. Let's be honest, porn is everywhere today. It's more accessible than it's ever been in human history. And while I'm not here to make moral judgments, I am here to tell you the medical truth. Excessive consumption can rewire your brain's arousal pathways. When your brain becomes accustomed to the constant novelty, extreme scenarios, and instant gratification of online porn, it can struggle to respond to real-life intimacy. I've seen men in their 20s with erectile dysfunction, something that used to be rare in that age group, and often heavy porn use is a key factor. This doesn't mean you have to quit entirely, but moderation is vital. Use it as a supplement, not a replacement for real connection. Your brain and your partner will notice the difference. Tip 5. Build a lifestyle that supports sexual health. This is where everything comes together. Your penis is not separate from the rest of your body. It's connected to your heart, your blood vessels, your hormones, and your mind. If you're eating poorly, barely moving, and living under constant stress, your sexual health will suffer, so here's what works. Stay hydrated. Blood volume matters for erections. Eat plenty of whole foods, lean protein, vegetables, and healthy fats. Exercise regularly to keep your cardiovascular system strong. Manage stress. Cortisol, the stress hormone, can reduce testosterone. Sleep enough. Poor sleep means poor recovery and lower libido. And please quit smoking. Smoking damages blood vessels and is one of the strongest risk factors for erectile dysfunction. It also increases your risk of Peyronie's disease. Limit alcohol. Heavy drinking can cause short-term performance issues and long-term damage. Think of lifestyle as the foundation. Without it, nothing else will hold up. Bonus tip: sleep without tight underwear. Men have multiple erections during sleep. It's normal and healthy. But if your underwear is tight, it can compress your penis during those erections. That compression can cause micro-traumas, just like with partial erection sex. Over time, these small injuries can create scar tissue, leading to curvature. Sleeping without underwear, or at least with loose-fitting underwear, gives your body the space it needs to function naturally at night. So there you have it. 5 essential tips plus 1 bonus habit that can dramatically improve your sexual health. Keep your penis active. Maintain excellent hygiene. Avoid sex with a partial erection. Limit excessive pornography use. Build a healthy lifestyle. Sleep without tight underwear. Follow these, and you're stacking the odds in your favor for a long, healthy, and satisfying sex life. I'm Dr. Amelia Hayes. If you found this valuable, give this video a like, share it with someone who needs it, and leave your questions below. I'll see you in the next video.